This segment of Delmarva Life is brought to you by For All Seasons Behavioral Health and Rape Crisis Center.
While many mental health organizations have long waiting lists, For All Seasons has launched an initiative method that eliminates this burden. This allows individuals and families to walk into the agency during select hours and meet with a therapist the same day.
The benefits of this sort of accelerated care are pretty obvious and will surely provide speedier aid to those in need. So, we are joined this afternoon by Beth Ann Dorman. She's the CEO with For All Seasons Behavioral Health and Rape Crisis Center. Thank you so much for being here.
Thanks for having me.
Love talking to you. So, open access, what is that?
So it is a new model, and it is eliminating the wait list for mental health services. You know, we are still in a crisis from COVID. You know, some people say it's over, but the mental health crisis continues, and we have seen an uptick in rape crisis center needs and mental health needs in our community. And so our agency knew that we couldn't continue to do things the way that we'd always done them in order to meet this need. And so instead of folks calling now and getting on a wait list, we have created open access time. So there are hours each morning where folks can walk into our office and receive a mental health assessment and their first appointment, get all of their billing and all of their information taken care of with no wait list.
How's it working so far?
It's fantastic. We have been able to bring in 25 to 30 clients per week and then be able to assign them to the psychiatrist within 10 days. And so it's not just mental health appointments, it's also making sure that should there be a medication need, we can also get them assigned to the psychiatry team.
I love this idea. It's fantastic. What if, though, we've got a viewer that doesn't live here in this area? What about that?
So the beauty of where we are because of COVID is that we also see folks through telehealth. So we are actually serving 24 out of 24 counties in the state of Maryland,
wow,
although we only have physical offices in 7 locations across the 5 counties of the Midshore. So you can also do a telehealth appointment and then be assigned to a telehealth therapist.
Wow, that's amazing. So tell us, you've mentioned that you're still seeing an increase in mental health issues because of COVID. Does it, I mean, how is it? Does it continue to grow? Are you seeing it level out a little bit?
No, we're seeing a continued need. We're seeing folks who are able to recognize that it's about mental health symptoms now more than it is about diagnosis. You know, when I came here 2 years ago, we talked about diagnoses. Now we talk about stress, anxiety. We talk about parents who are feeling like their plate is already full and then one more thing happens. We're especially looking at children and the way that the pandemic has impacted their ability to socialize, to be present in school. And there's lots of trauma that happened over the pandemic that is still starting to surface and needing to be addressed. And so it's really a situation where, you know, our youngest client is a pregnant mom who we're trying to help understand what it's going to be like to have a new child, to our oldest patient is 91 years old. And so we see everyone, we see all folks regardless of the ability to pay. We take insurance, we take Medicare, we take Medicaid. So when you look at the population, and we also serve folks in bilingual languages. So we can serve English and Spanish in person. And then we have a new telehealth model where we can serve any language with an on-demand interpreter. So when you put those factors in place and you then put the mental health needs and mental wellness of our community, it increases the need, and it also increases people's ability to be able to receive access to care.
So you said the full plate, and then there's that one more thing. And I hate to admit that I've been there before.
Sometimes I have multiple plates that then have too many plates.
So when they get to that one more thing and they just can't think this through, what should they do next?
So all they need to do is give our office a call. We can help and walk you through the steps. You know, it's 8 to 10 Monday through Thursday in our Easton location. We also have space in our Denton location. We also have the telehealth spaces. And so any questions, just give us a call. You can also go to our Facebook page, which is For All Seasons Behavioral Health and RCC, or you can go to our website, which is forallseasonsinc.org. But simply just placing a call or going and trying to figure it out on your own on the website, we are always there to answer questions. And just to be able to walk in and know that that morning, if you're in crisis, we'll be able to take care of you. It should be something that everyone feels successful about when they're struggling.
Wow.
That's huge.
It is. Took the words right out of my mouth. Beth Ann Dorman, For All Seasons, thank you so
much
for coming in.